I started working for this company a little over 2 years ago, and right off the bat I was able to witness for myself the miraculous effects that these therapies could have on patients that were in terrible pain, where their jaws were locking up or where they weren't having much range of motion in their mouth opening or in their neck. Lo and behold, Dr. Amy said, well, Vicki, we need to talk to you about your problems. Well, I don't have problems. And he said, well, let's do a questionnaire just to be sure. So we start going over the questionnaire, and it gets to the part about the question about headaches. Do you have headaches? Do you have migraines? And yes, I do, but everybody has headaches and migraines. And he said, what do you do for them? I said, well, I take ibuprofen. It seems to help. If I take 4 of them, I can usually stop it right at the beginning, but if I'm not around any kind of medication, it will usually last for a day or so, and it's very annoying. And then I found that even when I was taking medication for every 6 hours or whatever I thought I needed because it wasn't going away, it seemed that the headache would last longer. So when he got to the question about accidents, I said, yeah, I've been rear-ended a few times. And he says, okay, think back, any others? And I said, well, yeah, but it was so long ago, 20 years ago. And he goes, when did you first start having these headaches? And I said, well, as I thought about it, it's probably about 6 months after I had that auto accident. And he says, well, sometimes things happen over time, and you definitely have scar tissue when you have a whiplash injury, and so that's probably when everything started. And sure enough, I would have migraines that would put me down, and had to be shut off. I couldn't be with my kids, and it was not fun for me. And they came pretty frequently. The headaches more so than the migraines. The migraines would be about twice a month, and but I was able, with medication, to get rid of those if I took them right when I felt a headache coming on of that magnitude, or what I thought was going to be really bad. And so he said, well, okay, very interesting. He asked me all the rest of the questions. He said, let's just see what this therapy will do for you. And so he performed the therapies, and the result that I had afterwards was I felt so light. And I really didn't notice that much of a change until he measured the opening of my mouth. And I have a pretty big mouth and I can open it pretty far, but to get a 12 millimeter increase on my very first therapy, I thought, well, yeah, that's pretty significant. Then I get out to the car and I realize I have to adjust my rear view mirror a bit because I'm sitting up taller, and I can look over my shoulder really easily when I need to look behind me to change lanes or whatever. And so I thought, well, yeah, that was pretty significant. I feel a lot better. My life has improved so much because I'm not hindered by headaches or migraines. I get to fully enjoy the things that I like to do, like especially being with my grandkids and spending time with my family and just enjoying life. And the best part is I get to share that knowledge and these therapies and this whole program with other doctors' offices and their teams, knowing that they're going to go back and treat their friends and family members and their patients and be able to change their lives as well. My name is Vicki, and I was a level 4.